everybody, and welcome to the program. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System, and we are coming to you initially, perhaps for your first view of this, although maybe you're seeing it somewhere down the line too, in November. Now, November is Lung Cancer Awareness Month, and so as is our standard practice here at Atlantic Health System, we're going to do everything we can to let you know about some of the important advancements we've made in the fight against lung cancer and really why it's so important that you keep things like screenings in mind when we start to talk about things like preventing lung cancer and improving your lung health overall. But don't take my word for it. I've brought in a couple of experts to help understand some of the details around this and help give you some easy facts to keep in mind. They are two of our expert pulmonologists. In fact, one of them may be a familiar face to people who view our programming quite a bit. I'll first introduce Dr. Fred Cerrone. Dr. Cerrone is the System Associate Medical Director for Pulmonology here at Atlantic Health System. He's joined us a couple times in the past to talk about everything ranging from sleep health to other lung cancer and pulmonology related issues. Sitting next to Dr. Cerrone is Dr. Bobby Patel. Dr. Patel is the co-director of interventional pulmonology here at Atlantic Health System. His first time on the program, so let me welcome Dr. Cerrone back and Dr. Patel to the program for the first time. Thanks for coming in, gentlemen.
Thank you, Luke.
Thank you for having us.
Sure. So as I mentioned, folks, we are going to be talking about lung health in general, but certainly November being Lung Cancer Awareness Month, some of those important things for you to keep in mind. If you have interest in any other topics, we've got those covered too. So go to atlantichealth.org, where you can search for all kinds of different conditions that you may be curious about or concerned with. You can find content on a lot of those things. And of course, you can also find access to all of our physicians through our Find a Doc link. Maybe you're just looking for a general physician. We've got information on all of those folks too. So I encourage you to check out atlantichealth.org. But they'll do that later. Right now, they're going to have to listen to us. I guess, Dr. Cerrone, since you've been here before, I'll start with you if you don't mind. It's, like I said, it's November, and we talk about really the importance of keeping people's lung health front of mind. And so many times when we talk about oncology, screening and scans and things like that are where we start. So let's start there. How important are those things to keeping an eye on people's health when it comes to their lung health?
Well, obviously, lung health is important, right, in general, right? And we always talk about smoking cessation. We talk about exercise. But I think sometimes people forget about, lung cancer, right? So everybody talks about, and very commonly, and we understand why, mammograms for breast cancer, colonoscopies for colon cancer, but we really want to make sure people understand lung cancer really is the leading cause of cancer death in the United States.
Is that right?
Yep. And it's probably it is the third most common cancer after breast cancer and prostate cancer in the United States. So it's really important to get the word out that, we do have this program for screening people for lung cancer because we know that if we can get to it early, that the survival, we can increase 20% in these patients.
Wow, that's a tremendous amount.
Right.
Dr. Patel, when you talk to your patients about, those folks who come in and they're like, all right, you know what? I haven't been able to kick cigarettes as much as I'd wanted to, or maybe I've got a family history of folks who have had issues with lung health. What do you tell them? Do you talk about screening and things like that?
Yeah, absolutely. So, we follow the guidelines for lung cancer screening if they're, of a certain age and smoking history. And even beyond that, if they have a family history or occupational exposure, something in their environment that may increase their risk of lung cancer potentially, we talk about maybe doing a CT scan on an annual basis, or at least starting with one to at least get the process started on seeing if you have any nodules or anything that we need to be on top of.
So let's say you have a patient who comes in and does start to show some concerning things, or something pops up. Let's start first with what patients can expect, or a run of show, if you will, for care. What happens first?
So typically, if they have a smoking history and some symptoms that can mimic lung cancer potentially, I do also remind them that, a cough or other symptoms can be representative of allergies, colds.
So don't panic, right?
So don't panic, exactly.
Right.
And then we get a CT scan or an X-ray leading to a CT scan for better evaluation of the lung tissue. Many times and most often, these nodules are small, they're picked up early, and they typically don't cause any symptoms.
Mm.
So if they have any symptoms, we do want to be on top of that to
That would
make
indicate they're perhaps a little further along in the
exactly,
journey.
yeah.
Dr. Cerrone, we've again, like I said, we've covered a lot of ground with you on this program in the past, but things are always evolving. What is the nature of our program for folks? What types of options? And I know Dr. Patel is involved in some robotics work as well, but I want to give folks a sense of the breadth and depth of how we can help them if something concerning comes along. What are our capabilities in this space?
Yeah, so we have a lot of options to us now, with our so-called lung nodule program. So, first of all, I want to tell people, lung nodule, when people now you can go onto my chart, you see these reports and it says lung nodule, and it's like,
Yeah.
whoa.
Yeah.
But, most lung nodules are benign, right? That, in other words, they're not cancerous, right? So just want to say that off the top.
Yep.
So in our lung screening program, we're really focusing on people who have smoked, right? I mean, there's certain criteria, age criteria, 50 to 77. You smoked at least a pack a day on average for 20 years, and you're still smoking or quit within the last 15 years. Those are the criteria, right?
Mhm.
And, we find those are the highest risk for obviously developing lung
That's the big
cancer.
one, yeah.
Those are the big ones. So it's really easy process. It's most insurance companies cover it. We just a prescription. The lung cancer screening program contacts them and they get it done. And literally it's about a 60-second scan.
Oh, it's
Yeah.
over before most
Yeah,
scans.
no dye,
Yeah.
it's less radiation than a typical CAT scan. So it's really easy to do. And based on that, then we decide, once a year or do you need something more often? So for that, it's an easy process. We try to make it as easy as possible for anyone to get that done, right? So, but we work together, if we do find something, unfortunately, then, we work together with our thoracic surgery colleagues as well as oncology colleagues, if necessary,
Mhm.
to get it done. And, and that's when we kind of, we have our specialists now,
Yeah.
like Dr. Patel, to start, do we need to investigate this further? Do we need to start looking at this a little bit more depth, like a biopsy or something like that?
Dr. Patel, I would imagine just from some of the other clinical areas we've covered on this program, that technology has really opened a lot of new doors for us in terms of how we can care for people. What is the latest in terms of the state of how we if we have to intervene
Mhm.
surgically, what do we do?
So we have state of the art robotic bronchoscopy technology. It's called Ion. Basically, what that means is if we detect a nodule that we have suspicion based on criteria we use, that hey, if this is cancer, we need to know about it.
Right.
We can go ahead and biopsy these patients. What that means is we have general anesthesia available for the patient. We put a breathing tube in, and then takes about 30 minutes. We put a flexible catheter into and navigate with a robotic technology to get to that tiny nodule and take biopsy samples of it. Oftentimes, we have a pathologist looking at it in real time, and it's a team effort here. It really helps navigate and biopsy really small nodules that potentially could be stage 1 and curative.
Catch them when they're really small.
Catch them when they're small.
Yeah.
Exactly.
How invasive is it? What's the recovery time? What are folks who may be, who may have to consider this as an option? What are they looking forward to?
So the beauty of it is it's a same day procedure. It's done in the outpatient setting. We have a wonderful team of schedulers who will call the patient and family with dates and times, and we get them in as soon as we can. The procedure takes 30 to 45 minutes. Really, you're in and out in about 4 to 5 hours between coming into the hospital and discharging after anesthesia. And we have results in a few days.
Speaking of results, and it doesn't necessarily have to be about this particular procedure in general, but, and Dr. Cerrone, you may have alluded to this earlier in terms of the value of catching things early, but how successful can we be in treating lung cancer? There are some cancers I know we've talked about in the past where they're very tough to find success with.
Yeah.
But in terms of lung cancer, how successful can we be in general for whoever wants, or if you both want to take a crack at it?
Yeah. So as I mentioned earlier, looking at with this lung screening program now and the studies that have been done, we definitely can get to these cancers earlier where the survival is at least 20% improved. I mean, that's huge, you
Yeah.
know. Before, because lung cancer is one of those cancers where, you know, if you have symptoms such as coughing or shortness of breath, it's, you know, it's usually advanced. So
Yeah.
we're trying to get it before people even have those symptoms, obviously, you know. And you know, I can't tell you this new innovations that we have, this new technology we have, you know, not just getting to these cancers early, making the diagnosis, but just think about it. We used to have to follow these cancers, more CAT scans, you know, yeah, that takes a lot
It's a
of,
long
it's a
window.
long
Yeah.
window, and people, you know, if you're anxious and you have to live with this, and now we can tell you the answer a lot earlier, you
Wow.
know.
I want to pivot just ever so slightly to a more general look at what people can do to be healthier, to improve their lung health, to avoid ever maybe even having to have legitimate concerns in this space.
Yeah.
What's your best general recommendation? What do you advise people to do? What do you tell folks who come and see you about ways they can improve their lung health? Dr. Sarni, do you want to
Simple.
start, and then
Yeah.
Dr. Patel will
Yeah.
lead?
Simple. Use it or lose it. Simple. Yep. You got to get up and move. You know, the best things for the lungs is moving, is whether it's walking, other exercise, just do
It's the
something.
basics.
Do something. It is just like for your heart. It's the same thing for your lungs. If you start using it, and it just helps your lung function.
Wow.
You know, look, everybody knows the basics about stopping smoking, right? We know that, right?
Sure.
You know, but there's some things, other things you can avoid, as Dr. Patel alluded to earlier. You know, your environment. You know,
Sure.
sure, we know that. You know, if you live in a more urban area, maybe there's a little bit more pollution, that kind of thing.
Yeah.
Try and avoid those kind of things. But it's
Maybe your
really about
job exposes you to certain
job
things you
exposure.
may
Yep,
want to. Yeah.
absolutely.
Yeah.
But it's really smoking cessation, and you know, we have many programs for smoking cessation is number one for
Yeah.
sure.
Dr. Patel, what do you tell your patients, and how responsive are they when you have these conversations? Because we all know adherence to doctor's advice is always it's always easier said than done sometimes. What's your experience been?
Yeah. So when they come in with, possible nodule and smoking history, we really sit down. We spend some time talking about different ways if they've had difficulty quitting smoking, different strategies that, one size does not fit all. Right. So people respond in different ways. Patients respond in different ways. So we really sit down. We talk about different things that they could potentially try, whether that's medications or something as simple as opening up a calendar, marking down 10 significant days or holidays in the year, cutting down. So we go through different strategies that and that may help.
Wow,
Yeah.
that's great. Folks, we've covered a lot of ground here, but this is a complicated topic, one with a lot of detail to it, and we may not have gotten to an element that you're curious about or want to learn more about. If that's true, I encourage you to go to atlantichealth.org, where you can learn not just about Drs. Patel and Saroni, but about our fantastic program, our smoking cessation programs. All that stuff is available online, and certainly it'll allow you to keep on top of future programs like this, where maybe we didn't get your topic today, but I bet you we will in the future. So on behalf of Dr. Saroni and Dr. Patel, I'm Luke Margolis. Thanks so much for joining us, and we will see you next time.